When to use antipyretics for post-surgery fever? Imagine waking up after surgery and noticing your temperature rising. It can be unsettling, but knowing when to take action helps you stay safe. Fever after surgery is common, but it's not always a reason to worry. Sometimes your body is just doing its job to heal, but other times it signals something more serious. So, how do you know when to use medicine to bring down a fever? That's what we're here to find out. First, mild fevers are normal in the days right after surgery. If your temperature is slightly elevated but you feel okay, you might not need medication. Rest, hydration, and monitoring are often enough. However, if your fever climbs above 101 degrees Fahrenheit or 38.3 degrees Celsius, it's time to pay attention. High fever can increase the risk of complications like dehydration or stress on your body. If you feel very uncomfortable or your body aches intensely, taking an antipyretic can help you feel better. Antipyretics like acetaminophen and non-steroidal anti-inflammatory drugs are commonly used to lower fever. They also help ease pain, which is a bonus. But it's important not to use them all the time without understanding the cause of the fever. Fever can be part of your immune system fighting an infection or healing process. Overusing these medicines might hide signs of a serious problem, like an infection at the surgical site. You should consider using antipyretics if your fever is persistent or if it's causing you distress. If your temperature stays above 101 degrees Fahrenheit for more than 2 days, or if you notice other symptoms like redness, swelling, or pus at the wound, you should see your healthcare provider. They can check for infections or other issues that need specific treatment. Monitoring your symptoms is key. Keep track of your temperature and note any new or worsening signs. If you experience difficulty breathing, severe pain, or if your surgical site becomes more red or swollen, seek medical help immediately. These could be signs of complications that requiring more than just medication. In practical terms, if your fever is making you uncomfortable or is high, you can take an over-the-counter medicine like acetaminophen or ibuprofen. Make sure to follow the dosage instructions carefully. Stay well hydrated and rest as much as possible. If your fever lasts more than a couple of days or if other symptoms develop, contact your healthcare provider promptly. They will evaluate your condition and decide if additional treatment, like antibiotics or other interventions, is needed. This way, you're managing your recovery safely while keeping an eye out for any signs of trouble.